Understanding stroke, causes, symptoms, and treatment, a life-saving guide. Time is life. Every second matters. Every heartbeat, every breath, every moment. A stroke happens every 40 seconds. In just 4 minutes, brain cells begin to die, permanently. A stroke is a silent thief. It steals movement, speech, independence, and sometimes life itself. But what if you could stop a stroke before it stops you? Stroke is not just a medical emergency, it's a race against time. And you have the power to recognize the signs, take action, and save a life. By the end of this journey, you will know what a stroke is and how it affects the brain, the different types of strokes and their warning signs, how to act fast in an emergency, the latest life-saving treatments available, how to reduce your risk and protect your future. Because when it comes to stroke, knowledge is not just power, it's survival. What is a stroke? Your brain is your body's command center. It controls everything, your thoughts, movements, speech, and memories. But the brain is also fragile. It depends on oxygen-rich blood to function. A stroke happens when blood flow to the brain is suddenly cut off. This can happen in 2 ways. A blocked artery, stopping oxygen from reaching the brain, a ruptured blood vessel, flooding the brain with blood and causing damage. When the brain is deprived of oxygen, brain cells begin to die. And unlike other cells in your body, they don't regenerate. Once they're gone forever. 2 types of stroke. What you need to know. Ischemic stroke. The most common type. Ischemic strokes make up nearly 85% of all strokes. They happen when a blood clot or fatty buildup blocks an artery, cutting off oxygen supply to the brain. Think of it like a highway blocked by an accident. Nothing gets through. Traffic piles up. Chaos ensues. In the brain, this blockage means neurons start dying rapidly. Common causes of ischemic stroke: high blood pressure, high cholesterol, diabetes, smoking, lack of physical activity. A transient ischemic attack, or mini-stroke, is a temporary blockage. Symptoms disappear, but don't be fooled. This is a serious warning. Nearly 1 in 3 people who experience a TIA will have a full stroke later. Hemorrhagic stroke, the dangerous bleed. Hemorrhagic strokes happen when a weakened blood vessel bursts, causing bleeding inside the brain. The pressure from this bleeding destroys brain tissue, leading to sudden disability, or worse. Think of it like a pipe bursting in your home. Water floods everything, damaging walls, furniture, the very foundation. In the brain, a burst vessel floods delicate tissue, causing devastating consequences. Common causes of hemorrhagic stroke: chronic high blood pressure, aneurysms, head injuries or trauma. Without immediate treatment, hemorrhagic strokes can be fatal. The key is acting fast. The FAST method. Spotting a stroke in time. A stroke is a race against time. Recognizing the symptoms early can save a life. That's why we use FAST, a simple way to spot a stroke and act immediately. For face drooping, ask them to smile. Does one side droop? A forearm weakness. Ask them to raise both arms. Does one drift downward? S for speech. Difficulty. Ask them to repeat a simple sentence. Are their words slurred? T for time to call. If you see any of these signs, don't hesitate. Call emergency services. Every second counts. The faster you act, the more brain you save. Inside the hospital. How strokes are diagnosed. When a stroke is suspected, doctors must act fast to determine whether it's a clot or a bleed. The right treatment depends on an accurate diagnosis. Tools used for diagnosis: CT scan. Detects brain bleeding quickly. MRI scan provides a detailed image of brain damage. Once the stroke type is identified, life-saving treatment begins immediately. Stroke treatments, life-saving interventions. Emergency treatments for ischemic stroke. TPA, tissue plasminogen activator. A clot-busting drug. Must be given within 4.5 hours. Thrombectomy, a minimally invasive procedure where doctors physically remove the clot. Emergency treatments for hemorrhagic stroke. Aneurysm, clipping or coiling. Seals off the ruptured blood vessel. craniotomy, or drainage. In severe cases, surgery may be needed to relieve pressure on the brain. Preventing stroke. The power is in your hands. Control blood pressure. The #1 risk factor. Eat healthy. Reduce salt and processed foods. Stay active. Exercise strengthens your heart. Quit smoking. Smoking doubles your stroke risk. Don't wait. Take action. Knowledge saves lives.